talking a few things from my perspective as a diabetologist about diabetes reversal, remission, cure, whatever you want to call it. So I put all the three names. So what's in the name, basically? The definition of reversal or remission or cure is simply, according to me, semantics. In the sense that we don't really have to bother about the ADA definition, this definition or that definition, which says HbA1c of 6.5 for 3 months, 6 months, 1 year, whatever, and no medication. To me, that is not reversal. To me, reversal is going back in time from where you are to a better metabolic state. So you may go from 8.5 to 7, you may go from 7 to 6, you may be on one drug, even when you are reversed, that is still reversal. Because you are going that much away from diabetes complications, which is what we fear. So it really doesn't matter what the definitions say. I'll try to be as quick as possible. I just want to tell you that I have been doing reversal for the last 7 to 8 years, much before it actually became mainstream. And we had presented data. I'm going to show you some of my own data as well. And my way of doing reversal has been modeled on Roy Taylor's method, and that is what we have done, that is what we still do. It has worked for us. So it doesn't mean it works for everyone, but it has worked for us. So I'm going to tell you the little nuances of that. So I do not have any disclosures for this talk. So what is the basic goal of diet for diabetes remission? According to definitions, it is an attempt to reverse diabetes state. That means you go to a normal HbA1c and sugars and no medication. That is what it is. But like I said, I beg to differ on that. But what are the core goals of remission? The core goals of remission, number one, is weight loss and then improved glycemic control, or rather weight loss giving rise to improved glycemic control. Fundamentally, what we need to understand is that it is weight loss that drives remission. I'm talking about the garden variety of type 2 diabetes. I'm not talking about special types of diabetes, type 1 diabetes or diabetes of undernutrition or anything. Lifestyle related typical garden variety type 2 diabetes is the one that is amenable to reversal or remission, what we call, nothing else. So basically, please remember that it is weight loss that drives remission. To the extent that the ADA standards of care in 2023 also talked about remission. That means it is not yet a standard of care. We are going to discuss that a little later. It's not yet standard of care. However, mention of remission is beginning to come into some of the consensus statements, which in itself is a big thing, that all is not lost and at least some degree of reversal may be possible in some individuals. So the basic principle is on the twin cycle hypothesis. Even before the twin cycle hypothesis, even from Elliot Justin's time, even from time immemorial, everyone knows you eat less, your sugars are low. Everyone knows that. However, it had to be put into perspective in such a way that you had to prove it. And Roy Taylor did prove it. How did he prove it? He did the counterpoint study and then he did the direct study, where this hypothesis is very simple. If you have a positive caloric balance, which means to say that for years together you have amassed calories, what happens is you start to accumulate fat. The fat spills over into the liver and the liver becomes resistant to insulin. If there is even more fat, that fat spills on into the blood and then you get fat in the pancreas. As much as just half a gram of fat in the pancreas is enough to cause insulin deficiency, half a gram. And he showed that. So he's done MR spectroscopy studies and showed that you eat a lot over a long period of time, you get a fatty liver, insulin resistance, you eat even more, get more obese, fat in the pancreas, insulin deficiency. So you have insulin resistance at the liver, insulin deficiency at the pancreas, and you get diabetes. So that's it. Simply put, the twin cycle hypothesis. Now, this cycle, if you want it to move in the reverse direction, You just convert the positive caloric balance, which I am showing you here, to a negative calorie balance, which means weight loss. It means the positive calorie balance has to go, it has to become negative, you lose weight, and the cycle will spin in the opposite direction, which means that you start to lose weight, fat gets out of the liver, fat gets out of the pancreas, insulin sensitivity improves, insulin secretion improves, and diabetes reverses. So that's the simple way that was put forth. I'm not going to show you all the data of Roy Taylor here. He did it first in a group of around 16 patients, 11 patients, showed the amount of fat in the liver, showed that it went away, showed the pancreas fat going away, and showed how the insulin secretion improved, even the first phase of insulin secretion, which is the hardest. Alright? So, what does a diabetic diet versus a remission diet look like? A lot of you are nutritionists, almost all of you are nutritionists. So please remember that a diabetic diet, so-called, nowadays we don't use the term diabetic diet, but the so-called diabetic diet is good for control of diabetes. At best, you could lose 3 to 4 kilos with a diabetic diet. You will be well controlled with medication. Whereas a reversal diet is completely different. For want of a better word, I'm using the word reversal because that's what everyone understands. It's probably not the right word. So this is what a diabetic diet looks like. So we have, your macronutrient, micronutrient, less carb, whatever it is and everything. Whereas a reversal diet looks something like this. So you have one shake and you have maybe like salads on the side and less number of grains and stuff like that. So these diets look very, very different. So this is the direct trial that I'm going to show you. It's one of the very well conducted, elegant studies that was done by Roy Taylor in the UK across private general practices. So clusters of general practice it was done in. It was 300 odd patients. The patients that were taken were diabetic patients less than 6 years, not on insulin, with a BMI more than 27. So this was the group of patients that was taken. And this is the very, very famous, now very famous slide that you can see here. And I direct you to see this one. The odds ratio of reversing diabetes by weight loss was 19.7. I mean, this is a crazy odds ratio. 19.7, where do you get such odds ratios? And then the best part of it is this slide. The more weight you lose, the more likely you are to reverse diabetes. So those who lost upwards of 15 kgs, 80% of such people reverse their diabetes. And then you have the 2-year data as well. So the overall reduction was around 46%. That means if you take the whole population that was studied, it was a randomized control trial. And at the end of 2 years, it came down to 36%. 36% is also not small for reversal. So this is the study of our population where we have, I'm going to show you more studies like this. This was published by us very recently. We did the immediate impact of a balanced, very low calorie diet on the metabolic health of Indian subjects. And you can see that diabetes, hypertension, dyslipidemia, NAFLD, all of these things, homocysteine, HSCRP, all of these things, most of it at least is statistically significantly reduced because of the weight loss, and this was just a follow-up of 2 months. Even the counterpoint study was 8 weeks, so we looked at everything at the end of 8 weeks. So this is another study. We had done about 350 odd patients, more than that. Again, the very low calorie diet and reversal of metabolic disorders. It was a real world clinic based study, and this poster of the same study that I showed you was presented this year at Chicago at the ENDO conference. And what you can see here is that there was a remarkable improvement in all the obesity indicators, measures of central adiposity improved more. Out of these, we had taken all metabolic disorders. So we had 117 diabetes patients, and in those with diabetes, there was significant improvement in NAFLD, hypertension, and obesity. But what is more important to us is that even in those who have not reversed completely, not reversed in the sense, not reversed in that actual, definition, even in those, Insulin and by the way, our population, unlike Roy Taylor's population, had patients with more than 6 years of diabetes, BMIs of even less than 25, then we had patients even on insulin. And in our population, at the end of it, insulin was stopped in 29%, reduced in 38%, oral anti-diabetic agents reduced in 22%, hypertension reversed in 14%, reduced in 10%, and NAFLD reversed in 41%. So, even if you don't reverse completely, look at the metabolic improvements in such people. Obviously, their risk factors are going to reduce, their vascular age is going to improve. So, that is what is very important to us. And this was the impact of intense caloric restriction on metabolic parameters in our cohort. I won't go into the details of this, but we had very, very encouraging results. As you can see there, the green portion, 42% completely reversed, same as Roy Taylor's data. And you can see here that the orange part, they were reversed, but we kept them on metformin, and 54% did not reverse. Now I switch to the next part. The next part is that, is reversal possible only with lifestyle? No, it can also be possible with anti-obesity medication, because the crux of the matter is weight loss. I'm not touching bariatric surgery today because of lack of time, but that is another modality of reversal of diabetes. So today we have anti-obesity drugs that have touched that of your bariatric surgery, the percentage of weight loss. I want you to pay attention to the yellow line below. So if you see the yellow line, this is the limit actually in long-term lifestyle therapy. That's 5% weight loss. At the most you can go to 10% weight loss. So as physicians, as nutritionists, I think it's very important for us to know our limits. What are our limits? That intensive lifestyle modification over a long period of time can result in just about 5 to 10% weight loss. But if your patient needs to lose 15%, 20%, 30% weight loss, you have to go to the next step. And the next step is pharmacotherapy, which bridges the gap between lifestyle modification and bariatric surgery. So if you want about 15% weight loss, which is sustained, you'll probably have to go for pharmacotherapy. So today you have the GLP-1 analogs, you have the incretins like tirzepatide, and then upcoming is CagriSema, and there is retatrutide, which was recently studied, phase 2 trials, which can give you up to 25 to 30% weight loss. So that is almost like bariatric surgery. Of course, some of them are still undergoing trials. So it's not to be forgotten that if you need to use medication to lose weight, to reverse diabetes, we should not hesitate to do so. These are some of the...
6 crore, take care.
Oh, okay, there's some announcement. Anyway, so the practical aspects are, which I want all of you to understand, is that only highly motivated patients can try remission diets. If the patient is not motivated, you can't do much. It has to be done under very close supervision. Sukhada very rightly said, you hit Google, you write reversal of diabetes and you hit Google, and you will get like 1,000 people offering you different kinds of solutions, but it must be done under close supervision with supplements, frequent follow-up. Choose your patients wisely. Remission is not for all. Please choose, judge, see who can do it, who can't. The other thing, important thing is the basic remission diet which is there. Whatever method you may use, I use meal replacements. Somebody else may use something else. The crux of the matter is it should be a low-calorie diet, not a very low-calorie diet, if you are attempting proper remission. So very low-calorie diet which you give in remission, unfortunately everyone thinks, oh, it is not sustainable. It's not meant to be sustainable. It is given for 4 to 6 months, then the patient is weaned off that diet, and then they are brought back into a more normal kind of diet. I won't say they will go back to their original diet, but they'll get into a better diet. So any VLCD that you give, any remission diet that you give, it is meant to be for a brief period of time, and then they are weaned off. While remission may not be the goal in all patients, reduction of medication, better metabolic parameters, and improved quality of life definitely are. So what is the future? Adherence to what we do, acceptance of whatever the results are, Durability, as I said very clearly, you keep the weight off, the reversal or remission stays. Otherwise, it will come back. And pleiotropic effects such as cardiac outcomes need to be studied with respect to remission diet. Please remember that at the end of the day, diabetes is a small spectrum of metabolic health. We are talking about so many things that come with diabetes, such as hypertension, NAFLD, fatty liver, PCO maybe, or so many other things. So you're going to get good effects on all of these things, and that's why in my studies I never take only diabetes. I take all metabolic derangements because they are all parts of the same spectrum and they do the same things. So to conclude, the traditional diabetic diet is still the most widely prescribed, which is standard of care. It can be dispensed even by general practitioners, dietitians, other trained personnel, etc. It is meant to be an adjunct to pharmacotherapy but causes only modest weight loss. Diabetes remission has proven to be effective in many groups of patients. As of now, remission needs to be supervised by experienced healthcare professionals and nutritionists. It should not be attempted by the public by themselves because they are obviously going to have a lot of deficiencies. They don't know how to wean it off and then they get the weight back on. So their fat percentage increases, the yo-yo effect starts. So the next time around they can't lose weight because their protein to fat ratio is very bad. So for remission, patient selection is extremely important according to me. So thank you all for your attention. I'm sorry for taking extra time.